All right. So Laura, thank you so much for joining today. I would love to have an opportunity for you to share your story and your journey with OCD and where you're at today and everything in between. Can you take a moment to introduce yourself and kind of tell us in a sort of minute or so how you discovered that you were experiencing OCD and
Mhm.
where you're at today in your journey?
Yeah, thank you for the opportunity to be here with you. I'm Laura Joseph. I live in Connecticut, and in 2016, I was diagnosed with OCD after about 10 years of kind of showing signs and symptoms. It's all too familiar with it taking that long to get a diagnosis, but it really reared its head when I got into a relationship for the first time, and about 99% of my day was consumed with thoughts about the relationship, the rightness of the relationship, and kind of questioning how I felt. So definitely jumped right into therapy. Thankfully, got a diagnosis, found immense relief when I did get the diagnosis because I could at least put my finger on something and get the right support. And obviously, it's now been a few years since then, gone in and out of therapy, different types of therapy too, and look forward to sharing a little bit about that. But can definitely resonate with what people are going through. It doesn't come, it's not mutually exclusive with how it attacks and what other things come along with OCD. So you're not alone out there in how you feel. Hopefully, I can support in making you not feel alone and helping you get some right resources as well, like the UBA.
Yeah, thank you, Laura. The part you said there about how you experience OCD like symptoms in relation to relationships, I think that's important because some people may think that OCD presents in the same way every time for every person.
Yeah.
So, from your knowledge now of understanding this disorder and seeing the way it presents in people, and I'm sure you've met other people that experience OCD along your journey, can you tell us a little bit about how OCD presents in different people in different ways?
Yeah, and one of the things that I learned right away about OCD is it tends to attack people in the value area that they care about the most, or something that's really prevalent and strongly of value to them. So for me, anybody that would know me knows that I hold relationships as a top tier value in my life, and intimacy and relationships in general were always just something that I tried to navigate in different ways. I avoided intimate relationships, obviously, for a reason, but it shows up for people whether it's a physical manifestation of OCD in touching something 10 times before something else might happen. There's always a kind of an end result that somebody's fearful of that might relate to that number one value. And that's really the crux of OCD, is kind of diving into what that value means to you, where that fear is coming from, and how it's manifesting in that anxiety disorder itself. But for me, it's shown up in perfectionism when I was younger, um, always needing something to be right, and really relating to who am I, and am I somebody who is acceptable in society, right? So there's a few themes that have arisen for me over the time of getting therapy. Talked in therapy today about self acceptance and self love still being a theme for me. And sometimes when that feels threatened is when my OCD and anxiety, mental health can go awry. So for anything that anybody's dealing with in terms of their subtype of OCD, I would encourage to kind of look at the subtype, look at the values that are associated to it, and kind of start to dive into that area, because the anxiety is really manifesting a certain fear that's prevalent for you.
Yeah, absolutely. Yeah. And from my experience working with people that have OCD, that experience OCD, there seems to be some days where things are really bad or times where things are really bad and overwhelming, and the obsessions are causing impairment in their work life or their personal life. How do you handle days when OCD feels particularly overwhelming?
Yeah. It's funny, I actually just had one last Friday, where it tends to rear its head more so for me. Mine is a lot of mental compulsions. So it's not really visible to anybody externally from me, which is a blessing and a curse. But also, it feels like a trap in your own mind. And last Friday, I kind of had a day to myself, which tends to be days where it's a little bit more prevalent for me. I could not get out of a spiral. I could not stop thinking about how do I feel about my partner? How do I feel about the current situation that I'm in? And I was able to identify it as OCD with how prevalent it was literally all day long, but I was just not able to get out of the cycle itself. I brought it up in therapy today. And as I was talking, I realized that one of my friends had called me, but instead of me talking about things that were going on in my own head, I tried to focus the conversation on something that she was bringing to me to be able to kind of get myself out of my own space. I do meditation. I do try to get out of my own head, but it wasn't really feeling like it worked that day. And instead of beating myself up, I allowed myself to take that phone call and really change the conversation pattern. The other thing I did that day, which actually was the biggest game changer, was our neighbors were out when I got home. And I ended up going to introduce myself and having a 45-minute conversation with the neighbors about nothing related to myself, nothing related to OCD, nothing, just a casual conversation. And it was kind of like a breath of fresh air for me, where it took me out of my head right back into the present moment, which is usually what's the most helpful. And by the time I was done, I had kind of forgotten how the previous part of my day had been.
Mhm.
Um, so there's some days that like that's something that I'm able to do. Other times I'll go take a walk. Movement is really helpful for me because it gets like the adrenaline pumping in a different way and puts my body in motion versus, my mind constantly being in motion.
Mhm.
Um, Going to see friends, usually being, again, OCD for me is related to relationships, but then putting myself in a space of um, friendly, platonic relationships and just kind of out of my own head is most helpful for me. So, usually anchoring on movement, but also then just connection with others for me is something that's really helpful. And knowing and reminding myself, which is something new for me, is reminding myself that it ebbs and flows. I have the perspective now to understand that this is something that's come up before that I've handled. And then that's also, you know, I don't want to say gone away, but subsided. So it's going to be there. It's going to be able to be identified and it's going to subside. And that's exactly what it did the day after.
Mhm.
And now I have a different perspective on it. But this took me, this is years of acknowledging, years of understanding thought patterns, and years of kind of being able to sit with that. I'm still again practicing not sitting in it, but sitting with it. And
Yeah.
I think there's a difference between the two things.
Yeah, let's hit on that piece for a second. So sitting with it instead of sitting in it. Can you elaborate a bit more?
Yeah, I think sitting in it is going to be feeding the fire, right? Is going to be literally saying, it's an autopilot thing for me. Sometimes it's hard for me to get that distance from it and say, okay, I'm sitting with it now and saying, I see you, OCD. I see you trying to come in. Um, I'm choosing not to engage today, or I'm choosing to take a pause and give you a 10-second space. That's sitting with it, right? So sitting with it, being a friend to it, kind of welcoming it, acknowledging it. I think the more we try to push it away, the stronger it gets. So when you sit in it, that's exactly the cycle that you're in. But when you sit with it, you can acknowledge it and give it less power over you and allow it to kind of like take a little bit of a back seat.
Yeah, I love that. There's such an overlap with anxiety and OCD. OCD sits in the anxiety disorders realm. There's so much of a connection, and as someone myself who has experienced anxiety, I really relate to that. I learned through therapy and through mindfulness meditation this concept of being able to separate myself from the thought and the
Exactly.
feeling. And what I try to teach people that I do therapy with is that we have anywhere from like 50,000 to 100,000 thoughts in a day. They're constantly coming up all the time. And a lot of us have the mistaken belief that all those thoughts are legit. They
Right.
all are real. They all are true. But
Yep.
in fact, what we found through research is that a lot of these thoughts are actually not based in reality. They're not, I call them in therapy hot thoughts.
Yep.
Hot thoughts, just um, thoughts that are based on things you saw on TV or heard on the radio, or someone said something that stuck with you. And, one of those thoughts could be something like, nobody likes me. That may be a thought that you have real quickly as you're like walking down the street because maybe you tried to wave at a friend and they didn't wave back.
Right.
Or he doesn't like me. or something like that. That would be a hot thought, because when you actually analyze that thought, you think to yourself, if you actually wrote that thought down on a piece of paper, which is called a thought record, you could say, well, people do like me. I have a good relationship with my parents and
Right.
my, partner, and I have friends that I hang out with. And so that statement is not real. Nobody
Yep.
likes me. That's not a real statement. That's a hot thought.
Right. Right.
So separating
Yeah.
those is crucial.
Yeah. You can start to challenge the validity of it by looking at it. Right. But when you're in it, and it's funny, part of the OCD cycle that I did get myself into is kind of you start to look things up, right? And you start to
Uh-huh.
kind of like Google things. And that was something for me, literally probably on my phone right now, is like, are thoughts real? Right. And it's like this idea of like proving to myself that um thoughts are exactly what you said. Most of them are not true. They're either something based in falsities, something based from a trauma response. Where are these things coming from? The ones that you attach to is most specifically, right? Other ones, for me specifically, I can have a million thoughts and not question any of them except for the million and one thought that I attach to and start to
Mhm.
kind of go down a rabbit hole with. And um, it can feel it's so hard to explain to somebody how real it can feel and that you feel like you have to do something about it. And yet every other thought you have, you never have that kind of, thought process behind it. So taking a moment to write those things down, taking that step back, that's where meditation has really helped me as well, of just like seeing the thoughts passing by. But it is a practice, both the meditation and just like being in the moment of having that moment to step back and start to acknowledge those things. And I understand for people how autopilot it can feel, how real it can feel, what fear, it starts to ignite within you, and how hard it is to separate and take a step back.
Mhm. Yes. And it sounds like you've benefited so much from therapy, which is one of the mainstays of treatment for OCD therapy. There's a bunch of different types of therapy. There's exposure and response therapy, there's cognitive behavioral therapy, there's a bunch of different subtypes, and some are geared towards uh, specific conditions or even people that have different personality types.
Hmm.
It sounds like you've had success with therapy. What other alternative or holistic approaches have you attempted that you found success with personally?
Yeah, it's a good question. And it's actually a timely question for me because I've taken somewhat of a pause with ERP right now
Mhm.
and diving into more, um, I don't want to say psychoanalytical, but more like a emotional therapy. So, me in this moment understanding that it's still a manifestation of a fear for me. What is that fear and how do I dive into that fear? Because the taking OCD as an anxiety disorder, I'm experiencing anxiety because of some fear associated to intimate relationships. And I wanted to start to look at that um, separately from the ERP, which I have also found value in both historically and most recently, where I've gathered the tools of ERP and how to practice ERP and how to, again, sitting with the thoughts, right? That's part of the ERP therapy. So now diving into more holistic, like health side of things for myself. I was actually diagnosed with ulcerative colitis recently, which is all um, for me trauma based suppression of emotions, and that really brought up a need to look at healing in a different way. So
Yes.
I've done some inner child work. I've done some, emotional based therapy, which is really sitting with emotions and understanding it's not real, but where is it coming from and why is it rearing its head?
Mhm.
Most often having themes as you go along in your life, that this consistent themes can arise, and instead of facing them and understanding where they come from, we kind of suppress them. Working with a naturopath and understanding different healing modalities in terms of the health side of things and physical health side of things, um, meditation, walking, um, journaling has been a
Mhm.
huge thing for me, of just being able to, like you said, like the thought pattern, thought record of where are these things coming from. And then one of the biggest things is kind of taking a lot of awareness for myself, but trying to do the opposite of things that I've done in the past. And that's really a collection of a lot of therapy modalities culminating into me being ready to approach things differently, where I'm now in a relationship. I'm now having conversations with my family about the relationship that I'm in. I'm now leaning into things in a different way than I have before.
Mhm.
Um, Sometimes self-inflicted of just like, I'm ready to do this now and I know that this is going to be beneficial. Um, and sometimes guided by a professional as well. So it's kind of been different modalities coming together to complement each other at this point, and me pulling on different levers when I need them from historical support as well.
I love that. It sounds like you have so many different tools in your toolkit to use in different situations. And that's something that takes time, and you've put in the
Oh
work
yeah.
to, years of work to get there. So
Uh,
I hope people hear that, because that it can be frustrating if you feel like you go to a therapist and you don't feel better. Well, then therapy is maybe not for you. That might be the thought you have, but the reality is that might have not been the best therapist for you, or maybe that therapy type wasn't the one that was going to help you. So stick
yeah.
with it, and don't be afraid to try different things.
Oh, 100%. I mean, I went through even the past couple months, I would say I did try EMDR. I tried a different like type of therapy. And for me, I would notice myself, I don't want to say, I think it framed things differently for me that wasn't most helpful for me getting through it.
Hmm.
There was an idea for me of not going in and repeating certain things, but how do I work through it? And
Right.
like you said, it can be exhausting. And I do encourage people to understand that it takes trial and error. It also is not a one size fits all. And that can be really hard too if you're seeking what other people are doing and saying, well, it worked for that person, it's okay. Like each person needs something different. One thing is also not going to solve. Like I was like, oh, I can't meditate. I'm never gonna like, be okay in my own head. And it's like, no, like meditation is one of the tools that I can pull on, and I, do it when I feel that I need to do it. But I've gotten a little bit more gentle with myself as to how and when I do certain things,
Mhm.
and understanding that it is kind of a cumulative additive effect. It's not like you're going to do one thing and it's going to solve everything. It's like over time, how consistent can you be with certain things that make you feel better, and
Mhm.
sticking to that and trusting in that process.
Mhm. And for those that may not be experiencing OCD themselves, what can friends and family members of people that experience OCD do to support them?
It's a great question. One is obviously encouraging people to get proper support. OCD is a very fragile diagnosis to kind of work with because it can be triggered in so many different ways when people think that they're helping you. And it's really challenging when you realize and you know that they're not, but you seek that validation and you want the reassurance so badly that I would pick a few trusted people that you feel you can truly explain what's going on to, who might understand it, be able to stick with supporting you in the way that you need. I have a few friends that are like, okay, and you're in a spiral and I'm gonna listen and not acknowledge, and we're gonna just sit here.
Mhm.
My partner now is kind of like, she'll literally send me a stop emoji and tell me to go like take a walk. Or send me articles that I've written, some that are on UVA, some just on my website, but ones that help me reflect on, okay, I'm in this spiral, and acknowledging it.
Mhm.
Um, but pick a few people. And to be honest, it does take the awareness of yourself to know that you're now reaching out for reassurance, or you're now doing, a certain compulsion that shouldn't be done, but give yourself grace in that. And um, pick again a few people that are trusted resources to help you when you need the help, and know that they're doing it out of love and out of support for what is best for you. But therapy number one, because a trained therapist is really going to know how and what to do and say.
Mhm.
um, and then you'll also get to the point where hey, I know I'm in a spiral, just need to say something, but don't acknowledge it. And that's really like when you've kind of gotten power of saying, uh, I don't need anything from you, but I kind of just need to go through these motions right now.
Sure. Makes sense. And last question, looking forward, what are your hopes for the future of OCD treatment and awareness?
Oh, I can only hope that people who struggle with it get diagnosed way sooner. I think it's something that, because it's an anxiety disorder, it can be so just misdiagnosed as general anxiety. And it's such a debilitating disorder for people who really are struggling with it, that average of 10 years for proper diagnosis is just, in my opinion, unacceptable.
Mhm.
And getting way more trained therapists in this, both from the diagnosis and um, ability to notice it and ability to kind of elevate and escalate support, um, and from treatment perspective. But it also takes people uh, speaking up and acknowledging when you're struggling and knowing it's okay to struggle. Everybody struggles. It's a huge spectrum, and we don't deserve to struggle the amount that people are struggling. And especially with OCD, it's not something that you need to struggle with as much as you're struggling with it. So, um, I can only hope there's more awareness, and that's part of obviously the work that I'm here to do is to share and spread awareness, make people feel less alone, help other people speak up about it, but also getting more people supported in the system. So thank you for the opportunity to bring awareness, and if more people are inspired by their own journey, turning and paying it forward to help other people feel less alone.
Mm. Thank you, Laura. That was amazing, and thank you for sharing your story and helping other people
Yeah.
who experience these conditions feel less alone.
Yeah, it's my pleasure. And if anybody's out there has questions, or even if you don't think it's OCD or something related, it's worth checking out. It's worth talking to somebody. Even if it's not, you still get support and feeling better. And if it is, you get the right support to feel better. So, um, you know, be open, and everybody deserves to feel good.
Agreed.